My Lords, the CQC has assured the Department that Sir Julian Hartley, the new Chief Executive, did not use the exact words attributed to him in the interview with the Sunday Times recently. However, the Chief Executive did give a very honest assessment of the Care Quality Commission's operational failings as a regulator and the challenges that do face it in regaining public confidence, and we do welcome his candour as well as his actions.
My Lords, it seems that reports available about the care homes which are needed are maybe 4 years out of date, which is a serious shortcoming. And at a time when the pressure is on to discharge people who need social care as opposed to medical care, does my noble friend agree that the serious problems in the inspection regime are a barrier to any kind of progress with hospital discharge, and that the aim must be to make the CQC the trusted organisation it once was, on which families can rely when arranging care for their loved ones?
My noble friend is quite right in her observations, and indeed serious shortcomings indeed are at play. And in terms of the age of the assessments to which my noble friend refers, that is of scant help to those who are seeking to make decisions either for themselves or for those that they care for. And so the CQC, under its new leadership, is indeed prioritising tackling the oldest assessments that have been made, and the first order of priority is to reduce that the registration backlog, which at present is over 10 weeks old, and address issues with the registration portal. And there's also been an independent review commission to look specifically at the technology that will also help reduce the backlog and provide the very necessary up-to-date assessments.
My Lords, can the noble lady the Minister say what urgent steps are being taken to restore public confidence in CQC's ratings, and in particular, what measures are being taken to ensure that both patient voice and that of their families is given far greater weight in the way that these judgments and ratings are made by the regulator?
Well, in terms of public confidence, I would agree it's absolutely crucial, and I think that's why honesty has been very important, and why the Secretary of State accepted in full the recommendations of Dr. Dash's review into the CQC, which was published in October. There is, in addition to new executive leadership, there is also a recruitment process underway for new non-executive leadership, including the chair. That is very important, and I do agree with her, the importance of the patient voice, because that will lead to greater confidence. There is a long road to go down, but I am absolutely confident we are well on the way.
My Lords, organisations such as the Medical Defence Union report that new healthcare providers are facing severe delays registering with the Care Quality Commission. These slow delays are slowing down the process of registering new patients accessing services. Therefore, can my noble friend the Minister outline what discussions the Government have had or will have with the Care Quality Commission to resolve this issue?
Well, I can assure my noble friend that the Department has discussions with the CQC at fortnightly meetings, and in those discussions it is about their performance, including clearing the backlog of registration of new providers, and this will continue in order to make the necessary improvements that the noble lady seeks.
My Lords, can the noble lady the Minister agree that a lot of the problems in care homes would be alleviated if becoming a carer in a care home required certified training, supervision and a defined career path, rather than a job of last resort for itinerant job seekers that it seems to be in many homes at the moment?
Well, I would certainly agree with the noble lady that workforces are absolutely crucial, and I very much value the contribution that's made by those who do work in care homes. Perhaps it would be helpful to say that in just last month, we announced that the Care Workforce Pathway, which is a new national career structure for adult social care, will be expanding to support opportunities for career progression and development. This is the direction of travel that we want to take.
My Lords, can I apologise for my inadvertent machine going off, but can I, whether the newspapers were correct in reporting what the CEO had said or not, I'm sure we would agree that Care Quality Commission has been found deficient in its performance. I particularly asked the question about its reports on maternity services, which is now in crisis. So can I ask the Noble Baroness, the Minister, what is the government going to do about evaluating properly the maternity services?
Well, I absolutely agree that the CQC has been deficient in its performance, and we can look back to 2023 for the roots of that, when a new single assessment framework for assessing providers, coupled with a new IT system and changes in the CQC's staffing model, were all brought into play. And that actually produced a stark reduction in their inspection activity, as well as causing huge problems in the times taken to carry out re-inspections. And so, in all of the ways that I've already mentioned, in addition to discussions, but also reducing the backlog, and also looking at the technology in all these ways and improving governance and also the staffing structure within the CQC. This is really a root and branch change and will greatly improve inspection for maternity units and others.
My Lords, Sir Julian Hartley, in the Health and Social Care Select Committee hearing, also said that the new IT system introduced by the regulator had been a complete failure. What steps will His Majesty's Government take to ensure that public bodies, not just the CQC, have adequate and effective rollouts of digital systems so that they can deliver on their performance and targets? And on the 6th of January, the Secretary of State announced that the Government were launching an independent commission on social care reform with the intention of forming a national care service. Can the Noble Lady the Minister please update the House on the progress made towards this commission?
Indeed. To take the second question first, the Commission will start its work in April. The Noble Lady Baroness Louise Casey has agreed to lead that review. The terms of reference will be published and the first report will be with us next year. To the important point about IT, as I mentioned in response to the Noble Lord, this did arise from 2023 and it is actually, the CQC has acknowledged, as we have, that we've seen huge challenges with the provider portal and the regulatory platform, and indeed the DASH review did talk about poorly performing systems hampering ability. This is not how the system should work, and as we move towards the 10-year plan with a move to digital from analogue, we will actually have that front and centre of how we work.
My Lords, the Secretary of State in July said, quote, the CQC is not fit for purpose. In terms of the systematic failings still in that organisation, can I ask what timescale the government have given the CQC to be fit for purpose?
The Secretary of State indeed did say that, and he was right to do that, and as I said, in that spirit of transparency. What I would say to the Noble Lord is I have mentioned the fortnightly meetings. That is a constant assessment until we have met the necessary timeframes that are only reasonable to assist people in making decisions. All of that, how might I put it, deep focus on the CQC will continue. I don't think this will be quick, but it will be thorough.
My Lords, 30 to 40% of public money given to corporate-owned care homes vanishes in profits. leaving little for frontline services. Almost all care homes forcibly closed between 2011 and 2023 were operated by for-profit companies. The government's promised crackdown on care home profiteering probably won't be even as effective as it is on water companies. So can the Minister say what will it take for the government to recognise that profit and care can't easily be combined?
I would just say to my noble friend that the independent sector, which isn't just the private sector, it's also the charitable sector, is an important part of the provider framework, and in fact we will continue to work with it to provide the right quality of services for those who need them.